Welcome, everyone, to the Empath podcast series. I'm your host, Steph Naval, and today we'll be talking about the mental health law. So, with the mental health law, our next guest is the VP for the Philippine Society for Child and Adolescent Psychiatry. She's also the chair of the Department of Psychiatry at SLMC Global City. She's the training officer section of Child and Adolescent Psychiatry at TMC. She's the former president of Philippine Psychiatric Association from around 2019 to 2020. She was also one of the advocates and members of the team who lobbied and advocated for the mental health law. So, without further ado, I would like to introduce Dr. Vanessa Cainghug.
Hi,
Yay!
hello, Steph.
Hi!
Thank you for
Hello!
inviting.
Yes, of course. Thank you for coming to the show. So, for today's episode, we'll be talking about the mental health law. And given from your experience and the lobbying and advocating that your team did for the mental health law, could you share to us the process and maybe start with the problems that you were first trying to address with the country that would have caused the enactment of the mental health law?
Okay. First of all, our country was the last country who had a mental health law enacted. So we were very late talaga. But we started the crafting of the law a long time ago pa. I think that was 20 years ago when it was started. But
Mm-hmm.
it was actively lobbied for and became a law in 2018, right? 2018, yun. I think several issues were already there and were important such that we really needed a mental health law. Una na nga is the uh, rights of the patient, and not just the patient but also the treating professionals have to be taken care of. And also because the issue of mental health is really a complicated one. That's why uh, having a law will uh, help the patient help the patient's rights be protected. Kasi since it's complicated, it can be subject to abuses, di ba? Because mental health is really a product of several factors and issues. Kaya
Mm-hmm.
napaka delikado for it to be abused. Okay.
Yes, that is very true. They're one of the most vulnerable groups
Mhm.
in society. And
Mhm.
it's great that you as a team were able to recognize this problem and be able to lobby for it for the
Yeah.
mental health law. I remember talking to one of your team members who see Dr. June.
Yeah,
Um,
she's a senior consultant sa psychiatry. She's very prominent psychiatrist.
Yes, it was really great interviewing her because she was able to talk about the origins or what her rationale was with the mental health law. It was grounded from human rights. She was saying that what's also different from other mental health laws in the from the Philippines and also in other countries and also from certain mental health public health laws so would be that it actually had more of a human rights approach and it was around 20 years still that before it actually became a law
Yeah,
and
that's right. That's right.
mainly it was also the approach that they wanted to do for human rights so access for mental health care and also the protection of rights for the patients and also the families
Yeah.
so
Mhm.
given this, can you share to us your personal experience with, I guess the certain process about it? I remember you saying that you had to go around conventions or something to be
Mhm.
able to talk about the mental health law.
Mhm. Actually, I was just part of it, no. I wasn't there when it was started kasi that was 20 years ago pa. But the process is really you get various professionals to
Mm-hmm.
write certain aspects of it. For example, for this section, you get the experts to write it. For example, for occupation, the mental health issues in occupation, you get the professionals involved in occupational medicine, uh, labor, etc., so that they can come to an agreement and write the section on that. For schools naman, you get the experts on this part of the law. You get the educators, the guidance counselors, the psychologists, so that they can contribute to the law. For the neurological aspect, you get the neurologists to write. For the psychiatric aspect, the psychiatrists. And for children, you get the pediatricians also. For the
Yes.
geriatric aspect, you get the geriatric medicine,
Mm-hmm.
right? So uh, all of these professionals contributed their expertise for each section of the law. And then for the private sector, we compiled the contributions of the various sectors. I remember that we had several workshops in writing and compiling all of this. And then we submitted it to the Department of Health because they were the uh, final government agency who will give it to the president for signing.
Mm-hmm.
But I know also that at DOH, they have their own system. I think that they also wrote their version. I don't know their system na. Okay.
Mm-hmm. Okay. Um, thank you so much for sharing us the process of how you came about, how there was many concerns in the Philippines, and how you were able to gather various experts from different fields. So given that it's an enactment already, especially when it's already effective around it was 2019 already. So can you share with us the implications of it with the school sector or the workplace and why it's so important for Philippine society?
Okay. Before we had a mental health law, uh, people with mental health illness were really apprehensive to come out that they had this problem or a certain illness which involved their mental health, because they were scared that one, they could lose their jobs, or for example, if you're a student, that you will be asked to leave the school. uh,
Oh no.
so that's just an example of the fears, and then of the fears of patients, and also uh, the compensation, the financial compensation was usually non-existent then, di ba? But
Mm,
after the law was enacted, this was taken care of. So after the law came out, it was specifically stated in the law that you cannot fire a person just for mental health, or if the
mm-hmm.
just because the person has mental illness, and
Wow.
you cannot terminate a student from a school just because the student has mental illness. So people now with mental illness can take a leave if the illness strikes them, they can take a leave from school or from work. that's
Mm-hmm.
that's the most important thing that happened. And just to put it simply, okay.
Mm-hmm.
And as to financial compensation naman, before, there was no insurance in the Philippines that covered mental health, because this is, I repeat again, mental health is a very complicated illness, and it is usually chronic. It goes on and on. So no insurance company covered it. But after the mental health bill became a law, it was now covered by PhilHealth. Yeah.
Wow. Oh, that's really great. Yes, I think a lot of people will be able to benefit from this law and all the hard work. I know you weren't there 20 years ago, but you still were part of the team that was able to work hard for it and be able to lobby for it. So that's really nice.
I had a minor part lang sa PhilHealth. Uh, PhilHealth ba yun? Yeah, right, PhilHealth. it's also complicated to craft how it will be covered by
How was that?
oh, it's really complicated kasi they had to ask the experts then. For example, how long the illness will last, how much they will
Ah,
cover,
yes.
ganon, what degree of impairment ang i-cover, yung mga ganong aspect. They really had to meet with the experts who deal with these problems.
Mm. Can we dive in deeper just to explore first the implications for education and then after to explore the implications for the workplace, other
Mm-mm,
than, let's say, the leave of absences?
mm-mm. Uh, what do you want in particular?
Oh, I think there was a part about the parang mandatory in terms of the complementary mental health services for the
Mm. Ah,
schools.
yeah, yeah. It's also included na each company and each school should have its um, own mental health service. Ganun.
What defines a mental health service? Like, for example, GCU, guidance counseling unit, or it has to
That's a
be.
mental health service, guidance
Mm,
counseling unit,
okay.
or therapist. If the school offers therapy, that's a mental health
Mm,
service, or counseling, or
mm.
even a peer
Oh,
support
peer support
support
counts.
service. Oo. Yun.
Interesting. And then how about for workspace? So it's similar if they have
Similar.
even peer support.
Yes, yes. Sa work
Ah,
service, yung kanilang uh, HR, human resources, ganun.
okay. Interesting. Are there anything else do you want to add for the implications of the mental health law?
I think up to the present, we are still in the process of really implementing it, no? Kasi
Mm-hmm.
crafting the law is different pa from implementing it eh. After it became a law, the Philippine government formed naman the Philippine Council for Mental Health. Okay, it's made up of 8 persons, five from the government and three from the private sector.
Mm-hmm.
Okay. The three from the five positions from the government, I know one should be from the Department of Health, Department of Education, and I don't know the others, no. But from the private sector, one belongs to schools, education again, another for non-government NGOs, non-government organization, and another for medical association. Yun. So,
Mm.
three positions for the private sector. And this council will help in the implementation of the law. Yun.
Okay, thank you so much, Doctora.
Thank you
So
for
I think that's all the time we have. Oh, sorry, you said something.
thank you for inviting me and sharing my thoughts.
Yes, thank you. We'd really love to hear your thoughts. And thank you so much for coming. So I think that wraps up our episode. Hey there, it's Steph Naval. If you're interested on leveling up your mental health and overall well being, please follow our podcast to get free psychoeducational content. See you again in the next episode, and let's continue to advocate mental health care access for all.